Well, welcome. For those of you who were hoping to meet John Gresham, the famous author, I'm sorry to disappoint you. But the good thing is we do have an accomplished author here with us today, Dr. Geeta Nayyar. And thank you for coming to the next conference. Appreciate you being here. Just a quick introduction. So Dr. G as you go, but Geeta, is recognized as a chief medical officer, technologist, Wall Street Journal and USA Today best-selling author for the book Dead Wrong. It's a great book if you haven't had a chance to read it. She's passionate about using technology to innovate and transform care processes and how we think about automation, personalization, and scale of healthcare and how we need to accomplish that. So with that, welcome again, and thank you for joining us.
Thank you. Thank you for having me at the first next conference. I get it, Ron. I get it. It's hard. No, truly. Thank you, John. Thank you, Ron. Thank you, Brian, Monique. And my cousin Mo, who lives in Tampa, is here, so I have to say thank you to her. Thanks, Mo.
That's awesome.
I do have to just tell you, I am a little disappointed you're not John Grisham. When they invited me, I kind of misunderstood that part. No offense, John.
Yeah, that's how we got her here.
I was like, John Grisham, of course I'll do a fireside chat with John. And the funny story about that is my first inaugural book signing in Miami. It was, first-time author, very, very nervous. And I walk into the Books and Books, and it was like this amazing crowd, like double the size of this room. And I was like, holy crap, people are actually reading my book. It's not just my dad. And they were like, well, John Grisham's book signing was right before yours. This is the overflow. And I'll take it. I'll take it.
That's awesome. Well, really appreciate you being here. And you have an interesting path. You spent time as CMO of Salesforce and AT&T. Tell us a little bit about that. We're at the intersection of business, medicine, and tech. But what took you on that journey?
Sure. So I'm going to get a little personal since we haven't already, John. I have to tell you a little bit about my family. Mo can chime in as we go. But Mom is a triple-boarded ophthalmologist, OBGYN, internal medicine doc, India, UK, US, so she had to train several times. Started Hem-Onc, had me, so the story goes she dropped out of Hem-Onc because I was a little inconvenient. Dad is a double-boarded pulmonary ICU doc, come from a South Asian family of immigrants, came to America to give their kids the opportunity to also go to medical school and paid for medical school. So I say all of this because when I called to tell my mom and dad that I was going to be the doctor for the phone company, they were slightly disappointed. Slightly disappointed.
Yeah.
But the truth is, I am of the generation of physicians who went from paper to digital in our residency. That was a lot of fun. So we literally, side by side, I saw firsthand what paper could do for us and what the electronic health record was going to do for us. And I saw very quickly in my early 20s, not that long ago, but I saw very quickly the promise of technology. I saw very quickly, I understood this was going to be analytics. This was going to be how we share data, except we haven't yet, right? I understood virtual medicine was going to become a reality. I understood all of this very early, and I said, you know what? If I really want to impact healthcare, understanding those connection points between clinical medicine and tech is going to be key. And I know you all have lived through it. I also understood that the technologists had really good intentions, but really bad execution, right? They did not actually understand workflows. They did not actually understand what doctors needed, what patients wanted, which was for us to look them in their eyeballs and talk to them and really truly understand what it is that drove their care. So a number of opportunities became available to me, but it was definitely not the plan to work for the phone company.
Yeah. Well, it's a great path, and just kind of reminds me of you don't know where your future's going to head, and there's endless possibilities in healthcare. So I think we both spent similar times in healthcare. I spent, as Ron indicated, 20 years in healthcare with Cerner Corporation, around the EHR, and really all around digitizing, moving from that paper to digital record. And obviously, I think your book talks about this, but the industry hasn't yet, accomplished, how we think about, what I term as second order effects. And I'd love to explore that a little bit, and how you're thinking about how do we take advantage of all this digitization of the record, the patient, and how we think about them, but what does that need to look like moving forward?
Sure.
And so I think you have great perspectives on that, and excited to have you hit on that. So, with that, what do you see as key challenges, opportunities, for healthcare and health IT right now, from doing that?
Sure. Well, first of all, there's no doubt that we're living in a tech-forward world, whether in healthcare or out of healthcare. And there's no doubt that the consumer is only going to be more tech-forward, and the future generations of physicians, therapists are only going to be more tech-forward. What we have to remember, and I know we all want to forget, is that we are living in a really historic post-pandemic time. We have lived through a really, really amazing time in healthcare. Perhaps the only silver lining of the pandemic is that we saw tremendous innovation, right? Telemedicine being one of them. We just saw a quick overnight acceleration in a way that we have never experienced in our lifetime. So it has changed the game fundamentally for the appetite for innovation. And when we talk about the latest buzzword, generative AI, right? We have to be mindful of some of the things that we want to accomplish and some of the things we don't want to. But the second thing we have to remember is that we are living in a historic time as a result of all of this, of physician and care team burnout. 1 in 5 healthcare workers have left the healthcare industry since 2020. And those numbers are continuing to go up. And not the only reason, but one big contributor to that is bad technology. Is technology that actually slowed down our workforce and took away their joy, frankly, right? And so we have to be very mindful of that and think about how we can fix that, right? How can we automate the things we should and leave the human factor to those personal, intimate things that you all understand very well. We also have to remember that this is a time of new innovation and new partnerships, right? We've seen big tech come and go in healthcare. We've seen retailers come and go, Walmart most recently, right? We are living in a world where we as healthcare providers can't actually do everything alone, right? We're simply not going to be able to, and that's always been the mantra of a lot of healthcare leaders is, well, we're going to do it ourselves. We're going to build it ourselves. We're not going to partner with anyone. This is the era of partnerships. And let me tell you, what these non-healthcare companies are bringing is big pocketbooks, but also they understand consumer experience in a way that we simply don't understand in healthcare. We've been talking about consumer experience since the beginning of time, it feels like, right? But yet no one raves about their experience in a hospital, a waiting room, an ER, et cetera. It's always, gosh, I had to sit there, I had to wait. This remains still in this era of innovation, still the #1 experience is poor. And lastly, when we think about consumer experience, which is the name of the game right now, we have somehow, John, divorced that from physician experience. We have somehow said it's all about the patient, it's all about the consumer, forget about the staff. And we can't do that. And you all in this room understand this better than anyone. If you have a burnt out workforce, you will never have a good consumer experience. Does that make sense? Does that resonate? Yeah. Every provider group, every hospital group, SNF, rehab center, you are only as good as your workforce. And you know why patients come there? Fun fact, 92% of Americans still trust their doctors, still #1 source of trust. So if they refer you, if you have doctors at your facility, they're coming for that. They're not coming for the tech, they're not coming for the banners, they're not coming for the coffee, right? But 52% of Americans do not trust the healthcare system in which their providers operate in. Wow. And they understand the word workaround. They understand that the best doctors and nurses work around the technology, work around the system to take care of you. And that is fundamentally something we have to shift in an era where no one is really trusting science anymore, right? They'll still trust that one person, right? My patients will still come see me because I'm Dr. G and they know me, in spite of the really bad front desk staff, in spite of the waiting room time, right? And so if we can continue to marry the patient-physician relationship, the patient-therapist relationship, that's the money.
Yeah.
we can't forget consumer experience, workforce experience is fundamentally tied. And so if we can make our workforce faster, better, stronger, smarter, we are automatically going to have a better patient experience.
Well, that really resonates, especially as Ron's talking about the things we can do better. And you know, I've been on a journey as I've come to the company recently. I'm about 90 days in, and I've been on a listening tour with many of you all here in the room, and hope to continue to hear from you throughout the course of the conference. But also listening to, you know, taking my experience in healthcare IT over the last 25 years and kind of hearing, you know, how are we doing that here for our customers. And I think we have an opportunity and a tremendous opportunity for everyone here in this room and everybody we support across our 25,000 facilities to really make a difference in how we lessen the burden of administrative tasks. How do we help improve job satisfaction? And that takes a lot of work. We had a client advisory board yesterday, and we were talking about those very things. And we have to be willing to continue to innovate, look to outside partners to help us go faster. Kevin Keenahan, our Chief Product Officer, later is going to talk about some of the things and the rest of the product team we're doing to improve that. But that's really important, and that work's never done. We have to continue to adapt, continue to innovate, because, you know, the market and the reimbursement models and everything else are not making it easy. And there's requirements that we have to make sure we meet from a regulatory and clinical and compliance perspective, but how do we make that also a joy to use the system? And I haven't met very many people that are like, I find joy in an EMR, right? You know, but you know, we have to do that. It's a necessary requirement, and people need to start to see the benefits of analytics, AI, you know, other benefits of how it helps run their business, not just I'm digitizing the record for the sake of digitizing the record. So that kind of leads me to kind of my next question, which is, you know, as we head into this next era of technology, innovation, everybody's talking about AI, you know, what do we need to be mindful of as an industry, you know, the hype of that and the marketing around AI and what we're doing. And look, we do many things with AI today as a company. We'd like to do more. But, you know, what's kind of the hype versus reality in your mind to that, and how we should think about that?
Sure. So anyone heard of generative AI? Right? So this is the latest buzzword. But, you know, what I would say is that we've had a lot of innovation in healthcare. And we have to remember, as cool as generative AI is, and I'm a technologist and a physician, so I get it, and I am also incredibly excited by all of the possibilities. But we do have to remember that we are still living in a time where the fax machine is single-handedly being held as a business because of the healthcare industry, right? So we're talking about generative AI replacing you guys, right? I'm sure you've heard it. Generative AI is going to take your job. We're not going to need doctors. We're not going to need nurses, right? And yet we're having this whole conversation over a fax machine and getting labs, right? So the reality is we have a long way to go. We have a lot that we're still learning and understanding, right? We need to take a crawl, walk, run approach. We need to still understand what this technology can do. And there's a lot of really low-hanging administrative things that generative AI can do today. And those do not include replacing the provider, replacing the therapist. That's the wrong place to shoot. It's the wrong problem to solve. The problems to solve today are, number one, documentation, right? No one became a therapist so they could document. No one became a therapist so they could do prior auth, right? I know you guys are really smart. I want to believe I'm really smart as well, but I don't know everything at the bedside. And so clinical decision support, I'll take it, just like I do now with all the other tools that I have, up to date, et cetera. I need to look up something to be smart and fast. That's a huge asset to me and the entire care team. And thinking through diagnostics and therapeutics. It is amazing what we did with the mRNA vaccine. It's amazing what we did with the COVID vaccine. Being able to develop world-class therapeutics in record time is the future, and it's the right place to shoot. It's the right place to focus. But what we have to remember, the COVID vaccine being a great example, we developed a world-class innovation in 9 months flat, right? The world had a baby pretty much. And it's 2024, and we still can't get people to take advantage of that innovation. Why is that? Because we missed the human factor. We missed that we had to understand our patient, our consumer, their fears. We missed it. So I'm a big believer that innovation's great, but if you just innovate in the lab in a petri dish, you haven't really saved the world. To save the world, you have to understand people. You have to understand that healthcare is a human business. It is the business of humanity. And you guys do that best. There is no generative AI tool that is taking your job. But if it can be in the background, if I had R2-D2 in the background, doing all the work I don't want to do and didn't go to medical school to do besides working for the phone company, yeah, I'm all about that. Just like I am about my CT, my MRI, my stethoscope. Technology is not new to providers. We love technology that works with us, that works for us, for our patients. That's the issue. We have so much technology now that we've slowed down the workforce. So we have to get really smart, and I'm thrilled to hear Ron's comments of, you got a partner here who wants to work with you. Do not be quiet, because they don't all want to, right? We have an epic problem in healthcare.
Low blow, low blow.
I had to.
Low blow.
So that's the key. It really is partnerships, but it's also using the smart people in the room. I had to. Come on, you loved it.
Yeah. They're formidable. The competition makes everybody better. You know, I was at dinner with Dr. Blackman from Tulsa, Oklahoma. They do mobile wound care. And we were just having fun, and Amanda, who was at our table, who's on our sales team, she did chat GPT and asked about a wound, and we were pretty impressed with what came back. She just happened to have it on her phone. I mean, who doesn't have that on their phone? But we were pretty impressed, but it by no means gets to where the clinician, you know, needs to provide their great insights. But how can we take advantage of what is there to speed documentation, to speed how we can get to the most important element in the clinical workflow and make people more productive. And I think that's a big thing, is productivity is becoming such a important thing in healthcare with the cost of staff, and so we're being asked, and I'm hearing, how can you make us more productive? How can you help us to streamline our workflows and make it easier to move through the process to treat the patient so that we can spend more time with that important connection with the patient. So that's work to be done. You never end there. So you talked a little bit about new entrants. I had the opportunity, I was part of a 5-person team when I was with Cerner, you know, not that other company, but you know, I had the opportunity to lead our cloud effort of moving to the cloud and selecting. And so I got to meet with IBM, got to meet with Google, got to meet with AWS, and I owned kind of the market differentiation work stream. So it was like, how do we differentiate using the technology? And I got to see how Amazon was thinking about Amazon Health before it was out and so forth. And it was really exciting to see, and it was a learning journey for me in my career to see how a platform company, and that's kind of how I see those providers, they're looking to create technologies and tools that could be consumed by others as a platform, how they thought about innovation, and it was so consumer centric and so innovative in how they approached the problem. But we've seen with the recent Walmart news, like that's, you know, you've also seen those folks enter and then exit out of that. So it kind of leads to how should we be thinking about partnerships and, you know, this next chapter of healthcare. And I'm a big advocate for partnerships and built a lot of partnerships over my career with companies like Nuance and Imprivata that are very healthcare specific companies to broaden the portfolio. So you know, how should we be thinking about partnerships, and what does that mean to you when you say that word partner? And where do you see that headed?
Sure. So I'm also a big believer in partnerships because I think healthcare remains a team sport, right? We don't all have the answers, we don't all have the resources, and frankly, it's nothing that we haven't been talking about for a long time. There's a lot of work to still be done. I think it's the right kind of partnerships, right? And it's really understanding what your assets are and what your liabilities are, because we have seen a lot of companies come and go in the healthcare space. And a lot of excitement, by the way, built around them before we hear 2 years later that they're unsuccessful.
Right.
JP Morgan Chase, Berkshire Hathaway, IBM Watson, Walmart, we've seen them come and go. The interesting partnerships and the ones that I think we should continue to watch and invest in are when we find these non-healthcare companies that, again, bring the consumer experience, bring the big pockets, bring the pizzazz, but partnering with healthcare entities like yourselves, people who really understand the industry, but perhaps don't have as much know-how or innovation appetite. A couple of examples of those. So Best Buy Atrium. I don't know how many of you are familiar with the partnership with Best Buy and Atrium, but Best Buy and Atrium signed a deal in which they started out with CHF patients, right? Transitions in care, patients who had CHF were treated in the hospital, but then there's a well-known data on CHF bounce backs. Patients go home, don't understand their medications were changed, had too much salt, they're back readmitted in the hospital 4 or 5 days later. All very preventable if we had known what was happening in the home, i.e. Best Buy. So not that it was innovative to now have a home weight scale or home blood pressure monitoring or being able to get in touch with a nurse, but what was cool to me about the Best Buy Atrium partnership is guess what Best Buy has that Atrium will never have? The Geek Squad. Because the #1 reason patients fall down with their remote monitoring devices is their Wi-Fi. It's their infrastructure. They don't know how to set up the device. Somebody moved the device and then they don't know how to fix it, right? Particularly in the 65 plus population, which are the ones that are the most expensive and have the most chronic diseases. So that is a really awesome partnership to see because they understood exactly what we talked about a minute ago, the human factor. They understood that people have watches, they have rings, people are measuring stuff. But for the population, particularly 65 plus, there were just basic home infrastructure stuff that Atrium was never going to solve, nor was interested in solving, nor had the workforce to solve. So it wasn't about the healthcare. It was understanding the home environment in a way that the hospital could never do, right? Meanwhile, driving outcomes, saving money, saving readmissions, saving ER visits, and if anyone's heard of value-based care, that's the way to do it, right? Another interesting partnership, Stanford and Apple. Stanford and Apple are doing a study right now on patients with AFib. So patients with AFib have to go on anticoagulants, as many of you know, in most cases. And anticoagulants are both expensive and dangerous. If you slip, you fall, you're playing pickleball, it's not a good thing, right? So Apple and Stanford set up a study where they're looking to see could monitoring for AFib actually serve as the intervention, and actually anticoags may not even be needed. Talk about cost savings, right? Again, really cool partnership. Big tech partnering with Stanford Health, who actually knows healthcare, knows patients, knows AFib, right? Another interesting one, Oshi Health. Oshi Health is a small kind of startup company. They have a very interesting model, primarily serving rural America, which we know is underserved, which we know 1 in 5 Americans are in rural areas where they can't possibly see a doctor in less than 9 months, let alone a specialist. So their model is a GI telemedicine model in which they offer telemedicine in GI specifically, but they are sending all the referrals locally to the rural hospitals. Great example of co-opetition, because what was rural health's first reaction to Oshi Health? You're taking my patients. You're taking my referrals. You're taking my money, right? And they said, no. We're gonna do all the stuff that's low acuity, easy, the screening, everything that can be done on a virtual visit. But of course, we're not doing a colonoscopy in Nebraska if we're in New York City. You guys do that, and by the way, those are the more expensive visits, and those are the ones that you want to get in sooner and not have to wait 9 months because you're so backlogged with just peptic ulcer disease and the easy visits that can be handled via counseling. So there are some really cool partnerships, but the ones that do it right are really nuanced, and they're really understanding that they need that partnership. Otherwise, we see a lot of glam, a lot of pizzazz, and Walmart, I have to say, I was very sad to see, Walmart exit because, Walmart's everywhere. 90% of Americans, this is their claim to fame, 90% of Americans can be found 10 minutes from a Walmart, but they didn't partner. Walmart didn't partner. They did what we all say, I'm gonna do it myself, right? And so I think the more we learn from that cycle, the more opportunity there is for us to all actually solve healthcare's dilemmas.
Great points. And I had an opportunity to work with Apple. I led some of the interoperability strategies for Cerner when Smart on Fire and all that was coming to fruition. It's actually where I worked with Tissue Analytics. Tissue Analytics, one of our product sets, was one of the first Smart on Fire applications that we had into our ecosystem. And in that work, also had a chance to work with Apple. And we were looking with Apple to bring the smartphone, iPads and smartphone, but for nurses, and bring that to the bedside. And I remember having to spend 4 weeks on their campus, knocking on their door, jumping out of bushes to track people down, to get them past what it would mean for an iPhone to be unlocked, taken into healthcare environment, and not be considered a medical device. They were so worried about becoming a medical device, but fast forward, they got past that pretty quick. We got an unlocked iPhone, and then we found out they weren't quite ready for the network needs of healthcare and some of those pieces. And so I think there's a lot of lessons learned, but it's exciting to see folks like Apple coming with HealthKit and integrating and bringing it together so people can continue to innovate around the consumer. And so as I think about that and going forward with Net Health, how are we, I think this partnership, that's a key word for me, and it means a lot to me as well. I think it's important for us to be a solid business partner. So how are we aligning with each of you all in the room around, the changing reimbursement landscape, the move to value-based care? How are we helping navigate? How do we help you get through that change? Because I think a lot of us are living in a foot in each canoe. Fee for service, and how do we maximize reimbursement there? But also, how do we start to live in a capitated, at-risk model? And then a clinical partner. We talked about streamlining, and we'll talk more about streamlining clinical workflows and really driving productivity and return on investment in the technology. And then a technology partner. So how do we think about continuing to innovate? And I think our goal should be we don't want all of you all to have to become systems integrators, piece it all together. So part of this conference is to connect and to collaborate and to learn how can we take the weight of some of those innovative partnerships, how can we take that off of your shoulders, let us be the integrator and the technology, but take your lead and listen to where you're going in the market and so forth. So I think that's really important for us as we move forward.
John's giving out his cell phone later if anybody needs it.
So, sure. Absolutely.
John Gresham and your phone.
I'm not. So kind of what do you think? You talked about post-pandemic, and in your book you talk a lot about the misinformation that occurred during that time, and it was really enlightening for me as I kind of read it. Kind of what was that one post-pandemic lesson that the industry should remember and take away from that event?
Sure. Well, again, I know that we are all trying to forget the pandemic and don't even want to hear the word COVID, but the truth is it happened, and I think it was a great reminder both to the industry as well as just all of us as people, that health is wealth, period. Right? And I know that resonates with a lot of you. I personally lost family members during COVID that passed, not to mention patients, colleagues. It was a horrific time, right? But the number one thing that the consumer has taken away is health is wealth. And if I can read about it on Instagram, if I can buy a supplement, if I can measure it, I'm going to put my money on it, John. I'm going to buy a watch, I'm going to buy a ring, I'm going to buy that supplement for $29.99. And if I can't get a doctor's appointment, that's okay. I'm going to follow that influencer on TikTok who says they'll make me young again. Does that resonate? The problem we have to remember, though, is that's where the consumer is at. Healthcare has left this huge gap, right? The consumer is hungry and thirsty for knowledge about their health because of the pandemic, even more so, right? The wearable market went from a $24 billion market in 2019 to a $54 billion market in 2024. So not only is the consumer hungry and thirsty for healthcare information or healthcare knowledge, but they're willing to spend their out-of-pocket money. These are not copays I'm talking about. This is, I'm going to buy you a Fitbit, an Apple Watch for Christmas, right?
I can't wait.
Damn, now you got it on camera. I can't go back up. So it's important that we remember, as healthcare, there are misfits out there, those spreading mis and disinformation. They are actually victimizing our patients because we're quiet, because we're so hard to find, right? We don't have a social media presence. We're not acknowledging that this is the way America's finding out about their healthcare. 59 million Americans turn to social media for healthcare decision making. 59 million Americans turn to social media for information about their health. And they're not talking about mammograms for the most part on TikTok. They're talking about that supplement for just $19.99. And you don't need a doc. I'm Dr. John Doe. I'm here all the time, 24/7, right when you need me. Where's your doctor? Right? So you as providers, though, we have this opportunity because of this technology. Why couldn't that be us? Why couldn't that be your facility that is meeting the consumer where they're at? Why couldn't we use social media, artificial intelligence to spread the facts? Because mis and disinformation is not new, by the way. It's been around since the Black Plague. What's new is the technology that we have today is spreading mis and disinformation 6 times faster than the facts, and healthcare is not paying attention. We've thought of mis and disinformation as this like the smell in the hospital, that disinfectant smell that everyone knows distinctly when they walk into a facility but doesn't mention. We've sort of accepted this is how we practice. And you guys know this best in wound care, right? The diabetic who's not understanding they have to manage their diabetes better to actually take care of the wound because someone sold them snake oil. Well, I took that snake oil. What do you mean my wound's not getting better? Or I was told I'd rub this thing with CBD on it and it'd get better. You guys know what I'm talking about, right? So it's actually making our jobs harder and worse. But if healthcare does not own this issue, I promise it will only get worse. And the thing that they're doing really well is they are building brand loyalty. Every one of your facilities, somebody is in charge of your brand, someone is in charge of patient engagement, patient acquisition, retention, but no one is talking about mis and disinformation. If you are in charge of value-based care, if you are in charge of patient engagement, if you are in charge of making sure your patients come and stay, this is your issue to solve. We have got to give you guys in the room a microphone to get the facts out there. And I talk about this in the book, particularly in chapter 8. The Cleveland Clinic did this incredibly well. You all know this. Cleveland Clinic, Mayo Clinic, they have outstanding digital presence. And not only do they have a digital presence in every aperture that a consumer has found, but you can actually make an appointment anywhere in the country with one of their providers. They are accountable not just for the information they put out there, but if something goes wrong, they'll take care of you. How many of those folks on TikTok will do that? They won't. And those are the things we have to start talking to our patients about because this is the environment in which we live.
Yeah. No, I think our role is to, how can we continue to be an enablement partner for all of you all. We want to help you connect to the customer and the consumer the way that you're looking to for your business. But, how do we do that from a B2B to C perspective, business to business, back to the consumer? Our role we see is kind of an enablement partner. But again, how are you looking at innovating there, making sure we understand that, I think is really important for our role here.
And I have one more comment to make on that.
Please.
For some reason in medicine, we have always looked down on marketing. We have always thought, well, we're busy saving lives, right? And I just read that last paper in that last journal. Marketing is for quacks. Or marketing is to say we're on the corner of 6th and 7th and we're open 24/7 and we take these 3 insurances, right? Yeah. Marketing is now the new patient education, right? And you are competing with top-notch marketers in every industry now who claims to be a healthcare expert and yet doesn't have a license for anything, right? And I'm a rheumatologist, so I know this firsthand. We give some pretty scary drugs in my field. And the first thing I say when I make a new diagnosis of lupus, rheumatoid arthritis, et cetera, is please do not go on the internet. Please get off social media. I'm going to tell you the 6 places I want you to read. They include the Arthritis Foundation, the Lupus Foundation, and if you love social media, great. Here's the top 3 influencers I recommend. And if all else fails, there are umpteen patient advocacy groups that are on your side. Go to them, right? Go to the people that are accountable. We have to understand marketing is not a nice to have anymore. It is a must have.
Francesca, did you hear that? All right. Yeah,
She didn't even pay me to say that. Take the $5 later, Francesca.
No. You know, she does have a cool accent. You got Pittsburgh, and then you got Oklahoma. So, you know, I'm just proud to be here.
I was born in Beckley, West Virginia, believe it or not.
So kind of, what inspired you to write the book?
You know, I was sitting in my home office, like so many of us, and I really felt like COVID was deja vu. Mm-hmm. For me, it just brought me back to the HIV/AIDS epidemic. How many of you were practicing during the HIV/AIDS epidemic? It was an unforgettable time, particularly as a young physician in Washington, D.C. at the time. I was training at GW, and literally patients were walking in dead, right? Full florid AIDS, full florid coccidiomeningitis, I mean, everything, Kaposi's. They would just walk in and you knew they had very little time left. And I was a young doc in it for saving lives, in it because I wanted to improve people's lives. And I felt so helpless when patients would routinely come in and say, well, I'm not gay, doc. I can't possibly have HIV/AIDS. Or I'm not a drug user. I can't possibly have HIV/AIDS, right? And all of our professors at the time told us, you know, kids, we were basically kids in medical school residency, and we were told, this is a once-in-a-lifetime crisis. You're going to be better doctors. You're going to understand public health. You're going to understand humans better. And it will pass, right? And it will pass. And I remember saying the same thing to my medical students and residents during COVID. Only the overarching theme was exactly the same, which is in healthcare, we're so used to putting out the fires, right? We're so used to managing the emergency room that we don't think about who's starting the fires. We don't understand the communities that propagate mis and disinformation that make our jobs harder. And ultimately, all of those patients end up in the ER with the doctor, a therapist, someone helping them fight for their life, but it's often too late. Right. It's often too late. And I felt like this was just the big miss that we really never talk about in healthcare, just like that disinfectant smell. We've kind of just accepted this is the world we practice in, and we move on with our day. Does that resonate with you guys? Does that make sense? I can't imagine you've had too many speakers talking to you about mis and disinformation, right? Yeah. And here we are living in a consumer experience world, and a world where we have patient engagement tools. This has to be part of the strategy. It has to be part of the strategy because it's part of the problem.
Yeah. Was it Jerome in your book?
Yeah.
One of your patients that was going through HIV and was struggling, and I thought it was really interesting that, you know, the pivotal moment that played in your career and how you thought about that and how he was struggling with that and some of the misinformation and beliefs he had developed because of where the market was, and just how we need to change that script. And we saw it with COVID, and it's not just a technology and it's not just a social media thing. That certainly exacerbates it, but it's been occurring before social media was even, with HIV, was even around, and just kind of this misinformation or misunderstanding. And so all of us as enablers of technology, clinicians, providers, we have to be on the forefront of changing that. And that's kind of a lot of what I took from reading. So, you know, as you talk about how to do that, how to scale trust in healthcare, and how to you know, take a step in that direction. You know, talk a little bit about how you think about scaling trust.
Sure. So again, we are living in a time where science is not cool, right? I have a 12-year-old, so she reminds me of that occasionally. But we've lost trust in healthcare, right? And ultimately what brings our patients in is that relationship like we talked about. So one of the individuals I interviewed in the book was the head of marketing for Bacardi, for big brands, Coca-Cola, Pepsi. And I asked him the same question. I said, you know, how does marketing build trust? Because there's just some brands, you just, you know, you trust them. And you know if you go to the Ritz-Carlton, you're going to get a great experience. You know if you're at the Marriott or Hyatt, you know what to expect. What do we have to do in healthcare? And he said, it's know, like, trust. That's the model. That's what marketing uses, and maybe Francesca will shed some light on this later. But one, your customer, your consumer, they have to know you, right? They have to know you. So in today's world, you have to have a digital presence. You have to have a loud enough digital presence that they can find you. It's obvious that you exist, right? They know where you're located, who you are, et cetera. Second, they have to like you, right? They have to think there's something about you. Like, I thought it was John Gresham. I was like, yeah, I'm gonna love John Gresham, right? They gotta like you. And guess what? Part of being liked is like what color your hair is, right? Where you're from, right? And the number one question I get asked every time I drop off my daughter at her school is, hey, Dr. G, do you know a female cardiologist? Do you know a female pediatrician, right? Women like to see women. African Americans like to see African Americans. Women like to, like to see other women. Men like to see other men, particularly in neurology, right? So that's okay. We have to acknowledge that being relatable and reachable is the like part. And there are certain things in certain communities that are going to be attracted to certain things. And we have to look for that. We have to represent our constituents and be proud of that and be happy to take care of those communities. And then lastly, trust, right? What is trust? Trust is when I have a problem, I can get in touch with you, access, and you will show up to the best of your ability each and every time, and we will solve that problem together, right? There's probably a handful of people that you all personally trust, or in your workspace that you have a record with this person, with this organization, that they always show up. You've got a problem, you call them, you text them, et cetera. When you look at healthcare, we fall down on all three of those, right? Do I know you? For the most part, healthcare is still something where we ask each other. It's still word of mouth referrals. It's still about geography. We haven't fully gotten the memo that virtual medicine is available everywhere, anytime, right? The likability, we take care of minority communities, but we don't often highlight them in our workforce or intentionally recruit for them. And we need to do that. And then we can't ask ourselves why those communities don't come to us, right? And the last piece is trust, access. Access is the first part of that. I have to know who to call. And when I come to see you, when I'm looking for my therapist, I want it to be the same one each and every time, right? I want to have an actual relationship with you that I can actually know who you are and feel like, again, I'm looking eyeball to eyeball and you've got my back. And so when we look at marketing in particular, and I say marketing, but it's really technology, it's really that chief product officer, chief information officer, working with marketing, and then working also with the chief medical officer, right? I say it's the triple C-suite. Because this really touches all three buckets. It's the clinical bucket, the tech bucket, and the marketing bucket. And the only time those three people actually ever talked to each other, do you remember? Because I remember, was COVID. First time I met the chief marketing officer at Salesforce was during COVID, because she said, hey, Dr. G, I gotta get people into the office, out of the office. Are we wearing masks today, or are we not wearing masks? Right? And we should do that every day. We should do that every day in healthcare, because it is now an overlap. This issue is now an overlap. If we really want to scale trust, those three parts of the organization have to work together.
That's terrific, and appreciate those thoughts. Just because we kind of look to wrap up here, one thing I think is important is, what role do you see healthcare leaders and the folks here in this room needing to play in the future? And in a couple of words, how you think about that to take away.
Sure. So again, I know that we're all very excited about generative AI, myself included, but we have a lot of innovations to look back on and learn from. And the EHR implementation is really the first place to look, right? So much of the way EHRs were rolled out, so much of that innovation was done to doctors, to nurses, to therapists, to all of you in the room, right? And it disrupted your workflows, and it frankly pissed you off, right? And made you slower, right? This time, it has to be done with doctors, with nurses, with therapists, with people like you in the room, with you guys calling his cell phone, right? You have to have inputs into the innovation from the front lines of care. Not from the ivory tower, not from the wonky policy-making piece, but from the actual boots on the ground clinical delivery side. Because the closer the technology gets to the problem, the better it can innovate. And so this time, healthcare leaders, you need to be at the table, and you need to be vocal, and you need to invite yourself to the party if you haven't been invited already. That's really what has to be different this time. And when we look at social media in particular and where it plays into this, because it does play into patient engagement, marketing, et cetera, that is largely an unregulated space to this day, even though we have mounds of data of how this technology is actually lobotomizing our children, right? So we also have to innovate responsibly. And we have to understand that healthcare leaders can help us do that as we learn more about generative AI, what it can do, what it shouldn't do, et cetera.
Great. Well, really have appreciated the insights, and thank you again for coming and joining us at our next conference. And thank you again for the time, and just we appreciate you being here and sharing your insights and your experiences, and so thank you very much.
You bet.
Yep.
Thank you. I hope to be at the next. Thanks, John. That was great.